If your child has been diagnosed with ADHD, you've probably heard a lot of opinions about medication, some well-meaning and some alarming, and many completely contradictory. You may have heard things like, those pills will change your child's personality, or maybe ADHD medication is just legal meth. You may have heard once they start, they'll be on it forever, or that it's a gateway to drug addiction. The fears surrounding ADHD medication is real and completely understandable. As parents, we want to make the best decisions for our children, but when myths and misinformation cloud the conversation, it becomes nearly impossible to make informed choices. Today, we're separating fear from facts. I'm going to tackle the most common medication myths head-on with what the research actually shows. And I'm going to share a story that illustrates just how devastating these myths can be when they prevent kids from getting the help that they need. Welcome to Insights from Insight, Understanding Minds and Supporting Growth, a resource from Insight Education Academy. Before we dive into the myths, I want you to hear about a real kid. Let's call him Tyler. Tyler was diagnosed with ADHD in 3rd grade. Actually, it was the first time he tried 3rd grade because he had to repeat it. Tyler's mom refused to put him on a stimulant medication. She'd heard all the myths we're going to talk about today, and she was convinced that ADHD medication was just meth. She wasn't trying to be a bad parent, she was scared. She was also trying to protect her son. So they tried 4 or 5 different non-stimulant medications over the years, and Tyler continued to struggle. He repeated 3rd grade, he didn't score 3 or higher on any state assessments, not in 3rd grade, not in 4th grade, and not in 5th. And it wasn't until 6th grade when his mom finally agreed to try a stimulant medication that things started to change. But even then, she didn't give it to him regularly. When asked about it, she'd say he's old enough to take it himself. She'd been saying that since he was 9 years old. Think about that for a moment. A 9-year-old with ADHD, a condition that literally affects executive function and impulse control, was expected to remember to take his own medication consistently. During elementary school, Tyler could somewhat manage because homework was often formatted on a weekly basis. But in 6th grade, it became a nightmare. Tyler would spend time at his mom's house on YouTube. Not because he was lazy or didn't care about school, but because those quick format videos gave his brain the dopamine hits it was desperately craving. When he'd come to his dad's and stepmom's house, he'd have mountains of incomplete homework. He'd sit at the dining room table for hours, literally hours, trying to complete assignments that should have taken 30 minutes. This wasn't a kid who didn't want to succeed. This was a kid whose brain chemistry was working against him, and the one tool that could help was being withheld because of fear and misinformation. Tyler's ADHD is primarily an attentive type. He's not bouncing off the walls. The hyperactivity isn't in his physical space. It's all happening inside his head. Sometimes it takes him a full minute to respond to a simple question because his brain is jumping around so much internally. This year, with pressure from his doctor, Tyler finally started taking a stimulant medication consistently. He ended the first quarter with straight A's. Straight A's. Last year, when he started the medication late in the school year, he scored a 3 on his math assessment and a 4 on his reading, the first time he'd ever scored that well. It was the medication. The entire time. All those years of struggle, all that stress for everyone in the family, all of Tyler's frustration and damaged self-esteem. It could have been prevented if accurate information had been available instead of fear-based myths. Tyler's story isn't unique. Thousands of kids are struggling right now because parents have been fed misinformation about ADHD medication. So let's break down these myths one by one with what the research actually shows. First, we're going to talk about ADHD medication and changing your child's personality. This is one of the biggest fears parents have, that medication will turn their vibrant, creative, energetic child into a zombie, flat, emotionless, and no longer themselves. But here's the reality. When properly prescribed and monitored, ADHD medication doesn't change personality. It helps your child access their true self. Think of it this way. ADHD symptoms often mask who your child really is. The impulsivity, the inability to focus, and the emotional dysregulation. These aren't personality traits. They're symptoms interfering with your child's ability to show up as themselves. Remember Tyler? His personality didn't change when he started medication. What changed was his ability to show what he was capable of. He was always intelligent. He always wanted to do well in school. The medication didn't create those qualities. It removed the barriers that were hiding them. When medication is working properly, your child should be able to follow through on their creative ideas instead of jumping from one thing to the next. They should be able to engage in conversations without interrupting or long pauses. They should be able to complete tasks they start, and they should be able to regulate emotions more effectively. Here's the important part. If your child seems flat, overly subdued, or not themselves, that's a sign the medication or dosage isn't right. Not the medication itself is the problem. This is why close monitoring with your prescriber is essential. The bottom line is that proper medication should help your child be more themselves, not less. Myth number 2 is that ADHD medication is just legal meth. This is the myth that kept Tyler from getting help for years, and it's one of the most damaging pieces of misinformation out there. Yes, stimulant medications like Adderall and Ritalin share some chemical similarities with methamphetamine, but that's where the comparison ends. Here's why the legal meth comparison is completely misleading. First off, the dosage matters. ADHD medications are prescribed in carefully controlled therapeutic doses that are a fraction of what's used recreationally. The difference between medicine and poison is often just the dose. Aspirin can save your life or kill you depending on how much you take. Second, the delivery method matters. ADHD medications are designed for slow, controlled release. Street drugs are designed for rapid delivery to create a high. The way a substance enters your system dramatically changes its effects. Third, medical supervision matters. Your child's medication is prescribed by a doctor, monitored regularly, and adjusted based on response. That's not remotely comparable to street drug use. And finally, the brain chemistry matters. For people with ADHD, stimulant medication works differently than it does in neurotypical brains. It doesn't create a high. It helps normalize dopamine levels that are dysregulated in ADHD. Here's an analogy that makes sense. Saying ADHD medication is legal meth is like saying table salt is dangerous because it contains sodium, which explodes in water. Technically true on a chemical level, but completely misleading in practice. The bottom line is that ADHD medications are FDA approved, extensively researched, and when used as prescribed are safe and effective treatments. Myth number 3 is that ADHD medication leads to drug addiction. This is another fear that keeps parents up at night. Will giving my child stimulant medication increase their risk of substance abuse later in life? The research actually shows the opposite is true. And this is critical, so I want you to really hear this. A landmark 4-year study followed 260 children, 140 with ADHD and 120 without, and the findings were striking. Among ADHD adolescents aged 15 and older, 75% of those who were unmedicated developed substance use disorders. Compare that to only 25% of those who received consistent medication treatments, a rate similar to the non-ADHD controls at 20%. Let me say that again. 3/4 of unmedicated ADHD teens develop substance abuse problems compared to 1/4 of medicated teens. Here's why treating ADHD with medication actually reduces substance abuse risk. Untreated ADHD is the bigger risk factor. People with untreated ADHD are 3 to 4 times more likely to develop substance use disorders than those who received medication treatment. Medication actually has a protective effect. Far from causing drug addiction, stimulant therapy actually demonstrated a beneficial protective effect. Medicated ADHD patients develop substance use disorders at rates similar to the kids without ADHD. The type of substance matters. When researchers looked at specific drugs of abuse, alcohol, marijuana, cocaine, hallucinogens, and other stimulants, unmedicated ADHD youth were at significantly increased risk across all categories. Interestingly, among substance-abusing ADHD patients, marijuana was overwhelmingly the drug of choice, and virtually no one used other stimulants. Only one ADHD patient in the entire study used cocaine. Medication helps with impulse control. One of the core symptoms of ADHD is impulsivity, which is also a major risk factor for substance abuse. Medication helps improve impulse control, reducing one of the key vulnerabilities. Think about Tyler again. For years, he was self-medicating with YouTube videos, seeking those quick dopamine hits his brain was craving. That's exactly the pattern that can lead to substance abuse in adolescence and adulthood. When his brain chemistry was properly balanced with medication, he didn't need those constant hits anymore. The bottom line is that treating ADHD with medication decreases substance abuse risk. Not treating it increases that risk. Myth number 4 is that once they start medication, they'll be on it forever. Parents often worry that starting medication means a lifetime commitment, that their child will never be able to function without it. Here's the reality. Medication is a tool, not a life sentence. Research shows that ADHD symptoms persist into adulthood in approximately 50% of cases, though the presentation changes over time. Being in adolescence, ADHD symptoms often decline and change. Hyperactivity becomes inner restlessness, and the symptom profile shifts. But persistence of symptoms doesn't mean continuous medication is required. Many people use medication flexibly based on their needs. Some take medication during the school or work week, but not on the weekends. Some use it during high demand periods like college or starting a new job, and take breaks during less demanding times. Some develop coping strategies and life structures that reduce their need for medication as they mature. Symptoms do change with age. Hyperactivity and impulsivity symptoms tend to decline over time, while inattentive symptoms are more likely to persist. By adulthood, about half of adults with ADHD still experience significant hyperactivity and impulsivity, but 90% reported prominent attention symptoms. Some people develop coping strategies. As people mature, they often develop better executive function skills, organizational systems, and career choices that fit their strengths, and environmental modifications that help manage symptoms. Some people do choose to stay on medication long term, and that's okay. If medication significantly improves quality of life with minimal side effects, continuing it is a perfectly valid choice, just like someone with diabetes continuing insulin or someone with high blood pressure staying on medication. You can try stopping. Under medical supervision, you can always try reducing or stopping medication to see how your child does. If symptoms return and significantly impact functioning, you can resume it. It's not an all or nothing decision. The bottom line is that starting medication doesn't lock you into a lifetime commitment. Treatment can and should evolve based on your child's changing needs. Myth number 5 is that medication stunts growth. This is a myth based on outdated research and misunderstanding of the data. Let me break down what the research actually shows. A comprehensive study followed 410 children and adolescents with ADHD during long-term stimulant treatment, lasting between 1 and 16 years, with an average of 6 years. Here's what they found. There were small temporary effects. Stimulant treatment was associated with a relative reduction in body weight and a temporary slowing in height growth. However, these effects were modest. Weight measures decreased from baseline, but remained within or returned to the normal range over time. Effects did plateau over time. The largest decrease in growth parameters occurred in the first 12 to 47 months of treatment. After that period, growth measures stabilized and showed signs of catch-up. By 72 plus months of treatment, while children hadn't returned to baseline levels, the differences were clinically small. There were dose-related effects. Changes in weight and height were negatively associated with medication dose. Higher doses were associated with greater effects. This suggests that careful dose management may help minimize any growth impacts. And they do catch up. Long-term studies show that by adulthood, there is no significant difference in the final height between people who took ADHD medication as children and those who didn't. The temporary slowing during treatment doesn't translate to shorter adult height. Appetite suppression may play a role. Stimulant medications can decrease appetite, especially early in treatment. If a child isn't eating enough, that can temporarily affect growth. This is manageable with strategies like giving medication after breakfast, offering calorie-dense snacks when medication wears off, making sure dinner is substantial, and working with your doctor to adjust timing or try different medications. Monitoring is standard. Your child's doctor should be tracking height and weight at regular intervals. If growth is a concern, adjustments can be made. The bottom line is that any growth effects are typically small, dose-related, and often temporary. The benefits of treating ADHD typically far outweigh this minimal risk, but your doctor will monitor it carefully. Myth number 6 is that natural approaches are safer than medication. Parents often believe that natural treatments are inherently safer and better than chemicals. Let's break this down. Natural isn't regulated the same way as medication. Supplements and herbal remedies aren't held to the same safety and efficacy standards as FDA-approved medications. You often don't know exactly what you're getting or in what dose. Chemical isn't a bad word. Everything is made of chemicals, including every natural remedy. Water is a chemical. The medication in your child's prescription has been extensively studied for safety and effectiveness. Some natural approaches can help as complementary strategies. Things like adequate sleep, regular exercise, protein-rich breakfast, omega-3 fatty acids, mindfulness practices, and structured routines can all support ADHD management. But for most people with moderate to severe ADHD, they're not sufficient on their own. The research is clear. Stimulant medication is the most effective treatment for ADHD symptoms. Behavioral therapy is also effective. The combination of both is often the most effective. Alternative approaches show promise, but they need more research. A systematic review of neurofeedback, which is a non-pharmacological treatment that uses real-time brain activity feedback, found that it can be effective for ADHD. However, it requires a significant time commitment, typically 30 to 40 sessions, and works best in combination with other interventions rather than just as a standalone treatment. It's not either or. You don't have to choose between medication and other approaches. Most effective ADHD treatment plans include medication when appropriate. Behavioral strategies, school accommodations, parent training, healthy lifestyle habits, and therapy when needed. The bottom line is that natural isn't inherently better or safer. The most effective approach is often a combination of evidence-based treatments, which may include medication. Myth number 7 is that side effects are terrible and inevitable. Parents have heard horror stories about side effects and assume their child will experience severe problems. Let's talk about what to actually expect. A comprehensive survey of 585 adults with ADHD receiving medication treatment found that while 95% experienced at least one symptom that could be associated with ADHD or treatment in the past month, the nature and impact of these symptoms varied considerably. Here are the common side effects and how to manage them. One is a decreased appetite, usually most noticeable at lunch. Strategies include a substantial breakfast before medication, healthy snacks when medication wears off, and a good dinner. About 48% of survey participants reported insomnia or other sleep disturbances. However, this often improves after the first few weeks. Strategies include giving medication earlier in the day, establishing a strong bedtime routine, and avoiding screens before bed. Notably, about 81% of those with sleep disturbances were able to manage them with various interventions. Stomach upset is usually temporary. Taking medication with food often helps. Headaches often resolve within the first few weeks. Staying hydrated is important. Mood changes can include irritability, especially as medication wears off. It's called rebound. About 45% of participants experience emotional impulsivity or mood changes, though 84% were able to manage these symptoms with additional support. This often indicates the need for a dosage adjustment or trying a different medication. Not everyone experiences side effects. Many children tolerate ADHD medication very well, with minimal to no side effects. Side effects often decrease over time. The first few weeks are typically when side effects are most noticeable. Many diminish as the body adjusts. There are multiple medication options. If one medication causes problematic side effects, there are many others to try. Finding the right medication and dose is often a process, but most families find something that works well. Communication is key. The survey revealed that 35.7% of participants didn't discuss at least one symptom with their healthcare provider. Common reasons included thinking symptoms were tolerable, choosing to self-manage, or not wanting additional medications. However, open communication with your prescriber is essential for finding the right fit and managing any concerns. The bottom line is that side effects are possible but often manageable. Close communication with your prescriber is key to finding the right fit. Don't let fear of potential side effects prevent you from trying a treatment that could significantly improve your child's quality of life. Many parents ask about non-medication options. It's important to acknowledge that medication isn't the only treatment option, and it's not right for everyone. Behavioral therapy is an evidence-based treatment that can be effective, especially when combined with medication. It includes parent training in behavior management, organizational skills training, social skills training, and cognitive behavioral therapy for older kids and adults. Neurofeedback is an emerging non-pharmacological option that shows promise. A systematic review found that neurofeedback can be effective in reducing ADHD symptoms, particularly when protocols are personalized to individual brain patterns. However, it requires significant time investment, typically 30 to 40 sessions over several months, and appears most effective when combined with other interventions rather than used alone. School accommodations can make a huge difference. Students should have extended time on test, preferential seating, breaking assignments into smaller chunks, use of fidget tools, and movement breaks. Lifestyle modifications can support overall functioning, so things like consistent sleep schedules, regular physical activity, protein-rich meals, limited screen time, and structured routines can make a big difference. For some children, especially those with mild ADHD or who are very young, starting with behavioral interventions and accommodations makes sense. Medication can always be added later if needed. For others, especially those with moderate to severe ADHD, medication is often necessary for other interventions to be effective. It's hard to learn organizational skills when you can't focus long enough to practice them. The bottom line is that treatment should be individualized. What works for one child may not work for another. The goal is finding the combination of strategies that helps your child thrive. If you're considering medication for your child, here are important questions to discuss with your prescriber. First, you should ask what the medication options are and how they differ. Understanding the distinction between stimulant medications and non-stimulant options helps you make informed decisions. Research shows that both can be effective, though stimulants often show faster results, while non-stimulants may take 1 or 2 weeks to show effects. What results should we expect, and how quickly? Stimulant medications can produce almost immediate improvements in attention, impulse control, and hyperactivity, while non-stimulants typically require longer to reach full effectiveness. What side effects should we watch for? Common concerns include appetite changes, sleep patterns, cardiovascular effects, and in rare cases, mood changes. Your doctor should discuss monitoring strategies for height, weight, blood pressure, and heart rate at regular intervals. How will we monitor effectiveness and side effects? Ask about assessment tools like the Vanderbilt Screener, which can track not only ADHD symptoms, but also identify co-occurring conditions like anxiety or oppositional defiance disorder. What's the plan if this medication doesn't work well? Understanding that finding the right medication often involves trial and error can help set realistic expectations. Different medications work on different neurotransmitter systems, so alternatives exist if the first choice isn't effective. Can we try a lower dose first? Starting with lower doses and gradually increasing is standard practice and helps minimize side effects while finding the optimal therapeutic dose. Your doctor should outline the timeline for dose adjustments and what signs indicate the need for changes. Are there times we should skip doses, like weekends or in the summer? This depends on your child's specific needs and whether ADHD symptoms significantly impact functioning outside of school settings. How do we know if we need to adjust the dose? Regular feedback from both parents and teachers, along with standardized assessments, helps determine if adjustments are needed. What should we do if we miss a dose? Having a clear plan prevents confusion and ensures consistent treatment. A good prescriber will welcome these questions and work collaboratively with you to find the best approach for your child. Instead of asking, is medication safe, we should be asking, what does my child need to thrive? For some kids, that includes medication. For others, it doesn't. For many, it includes medication plus therapy, accommodations, and support. Research consistently shows that multimodal treatment plans, combining medication with behavioral interventions like parent-child interaction therapy and educational accommodations through IEPs or 504 plans, produce the most favorable outcomes. The evidence is clear. Medications have the strongest evidence base for improving outcomes, particularly when combined with psychosocial interventions tailored to each child's specific symptoms and circumstances. So what are the risks of not treating ADHD? The research on untreated ADHD paints a sobering picture. Adults with untreated ADHD face 2.4 times greater likelihood of being arrested. They have unemployment rates twice as high as those without ADHD. They are 3.7 times more likely to lack a high school diploma, and there is a 2.3 times higher risk of co-occurring mental health conditions like anxiety, depression, or substance use disorders. Beyond these statistics, untreated ADHD is associated with academic underachievement despite intellectual capabilities, social difficulties and peer rejection due to things like impulsivity and emotional dysregulation, chronic low self-esteem from repeated experiences of failure. There's an increased risk of anxiety and depression stemming from unmanaged symptoms. There's higher rates of accidents and injuries related to impulsivity and inattention. There's increased substance abuse risk, not from medication, but from self-medicating untreated symptoms. Employment difficulties in adulthood, including challenges with organization, time management, and maintaining jobs. There's relationship problems due to emotional dysregulation and communication difficulties. And all of this creates financial strain affecting both individuals and their families. Perhaps most concerning is that research shows that nearly 25% of inmates qualify for an ADHD diagnosis. And studies have found that violent recidivism rates were reduced by 42% when offenders received ADHD medication compared to when they didn't. This underscores how untreated ADHD can set individuals on a trajectory towards the criminal justice system, a path that early intervention can prevent. So how do we make an informed decision? First, by gathering accurate information from credible sources. Talking to qualified professionals who understand current research, considering your child's specific needs and symptoms profile, and finally, being willing to adjust the treatment plan as you learn what works. The evidence strongly supports that early intervention yields the best results. The cure is prevention, early intervention. When ADHD is properly diagnosed and treated with individualized, multimodal approaches, children can reach their full academic potential, develop healthy social relationships, and avoid the cascade of negative outcomes associated with untreated symptoms. The question isn't whether medication is safe. Decades of research confirms that it is, when properly prescribed and monitored. The real question is, what does your child need to live their best life? So let's bring this full circle. We started with Tyler's story, a bright kid who struggled for years, repeating third grade, never scoring proficiently on state assessments, spending hours at the dining room table trying to complete work that should have taken minutes, all because of fear and misinformation that kept him from getting the treatment he needed. When Tyler finally got the right medication and took it consistently, everything changed. Straight A's, a score of 3 on math, and a 4 on reading. And not because he suddenly became a different person, but because the barriers were finally removed. That's what proper ADHD treatment does. It removes barriers. It doesn't change who your child is. It reveals who they've always been. The myths that we've covered today have real consequences. They keep kids from reaching their potential. They damage self-esteem. They strain families. And in the most serious of cases, they set kids on trajectories toward academic failure, unemployment problems, and possibly even the criminal justice system. The research is overwhelming. Properly diagnosed and treated ADHD leads to better outcomes across every measure: academic achievement, social relationships, mental health, employment, and quality of life. But here's something we haven't talked about yet. Something that might be even more insidious than the medication myths we've just debunked. While Tyler's story is powerful, imagine if Tyler had been a girl. The statistics suggest she might still be undiagnosed today. Boys are diagnosed with ADHD at a rate of 3 to 1 compared to girls during childhood. But by adulthood, that ratio narrows to nearly 1 to 1. That dramatic shift reveals a troubling truth. We're not missing ADHD in girls because it's less common. We're missing it because we're not looking for it in the right ways. That's exactly what we're going to explore in our next episode. The gender and age gaps, why girls and adults with ADHD are still being missed. We'll dive into the stereotype of the hyperactive boy and leaving millions of girls and women in the shadows. The consequences of misdiagnosis in girls and women are staggering. If you've been struggling with a medication decision for your son, I hope today's episode gave you clarity. But if you have a daughter who's working exponentially harder than her peers, who seems spacey or talks nonstop, or who struggles with friendships despite being outgoing, maybe she's emotionally sensitive or disorganized, I need you to tune in next week, because the stereotype of ADHD as a hyperactive boy disorder has done enough damage. It's time to challenge these outdated assumptions and make sure every person with ADHD, regardless of gender or age, has access to timely diagnosis, comprehensive treatments, and support they need to thrive. Remember, you're not alone in this journey. Thousands of parents are navigating the same questions, fears, and hopes. The goal isn't perfection. It's understanding. It's giving your child, whether that's your son or daughter, the tools they need to be their best self. Join me next time as we shine a light on the girls and women who've been overlooked for far too long, and explore what needs to change so that no one else has to spend decades believing they're simply not good enough.